Vanakkam, Namaste and welcome to Dr. Shah's clinic. In this video, we are going to discuss on male fertility testing or male fertility tests. Now, how do you test if a man is infertile or how do you test if a man is fertile? Now, the simplest male fertility test that you can do is called the semen analysis or the sperm test. Now, what are the information or what are the clinical informations that you can get from a simple male fertility test like the semen analysis is that a semen analysis will give an important idea about the patient's or the individual's sperm count, the sperm motility, as well as the sperm shape, as well as the amount of semen volume. So, a normal semen analysis report will show a semen volume in the range of anywhere between 1.3 to 1.7 ml. Next, it will show a sperm count in the range of say anywhere between 13 million per ml to 16 million per ml. The sperm progressive motility should range anywhere from about 31% all the way to 33 or 36%. And the morphology, the normal range should be anywhere from about 3% all the way to 4%. So, if the individual has, semen, does a male fertility test and he finds the values within, these aforementioned ranges, the male fertility potential is said to be good for the individual. Not just that, what it usually indicates is that the likelihood of a pregnancy is usually quite high in the first year of marriage, provided the female partner is also equally healthy. So that's the first male fertility test. The second male fertility test that we normally advocate to patients is an assessment of the male sex hormones or the hormones of sperm production. So the male sex hormones or the hormones of sperm production come from the brain. It comes from a structure called the pituitary. And if you look at the image on the right, I have marked the pituitary in the image with a red circle. That's what secretes the main sex hormone, the male sex hormones. The main two male sex hormones that we primarily look out for is the serum FSH and the serum LH. And secondarily, we look at the testosterone, both the total testosterone, sex hormone binding globulin, and the calculated free testosterone with the help of albumin and sex hormone binding globulin. In addition, we also assess for prolactin as well as estrogen. So these are all the male sex hormones. In some individuals, the serum FSH and serum LH can be very, very low when you do a male fertility assessment. And what happens is the sperm production for these individuals can be absent. That is, these patients may have a condition called hypogonadotrophic hypogonadism. So assessment of the male sex hormones becomes a very important tool to rule out hypogonadotrophic hypogonadism. In some patients, the hormones may be very, very high. The FSH and LH may be extraordinarily high. That is more than the cutoff value of 7.5. And in these individuals, we use these set of male fertility tests to rule out hypergonadotrophic hypogonadism. So these hormones are very, very sensitive. In some individuals may even have erectile dysfunction. For this, we look at the hormone called prolactin. If prolactin is very high, we suspect a prolactinoma which is a pituitary prolactin secreting tumor. And for these patients, medical management can be used to restore the erectile function with respect to male fertility. So these hormones are in general very, very important. So normally, when an individual comes to a clinic for male fertility assessment, we take an in-depth clinical history. We then advise the patient a semen analysis, and the second level of testing is usually an assessment of the male sex hormone based on the history as well as the semen parameter report. So the third level of testing, which is usually not required routinely as far as male fertility testing is concerned, is doing an ultrasound scan of the testis, as well as doing an ultrasound scan to assess testicular structures and other structures, other male reproductive structures. So like the epididymis, the vasa, and other structures, in the male reproductive tract. So in some patients, may have azoospermia. This is a condition where there are no sperms in the semen. So in these individuals, the semen analysis will show 0. That is, sperm count will be 0 for these individuals. The semen volume may be low. So in patients who have obstructive azoospermia, the semen volume will be very low. And in these cases, the male fertility test of choice, apart from the hormones and semen analysis, is going to be an ultrasound scan to look and see whether there is any block or obstruction anywhere in the male reproductive tract. So there could be an obstruction at the level of the testis, that is, there could be an obstruction at the level above the testis in the epididymis, or there could be an obstruction at the level of the vas. So in some patients, they will have congenital bilateral absence of vas. That is, the vas itself will not be present in some individuals. You can look at the image on the right. I've highlighted what's the vas in the image on the right. So if these two structures are absent, the semen volume is going to be very low, and an ultrasound scan of the testis can usually pick up the absence of the vasa. So the three the two main tests that are usually required for most men who are looking for a male fertility testing is the sperm analysis or the semen analysis, and two is the assessment of the male sex hormones. The last test, which we had previously discussed, that is ultrasound scan of the testis, is only done in select individuals where we suspect obstructive azoospermia. Routine imaging studies are usually not required for patients with male fertility evaluation. So I hope you enjoyed this video on male fertility testing. I hope you gained some information on how to test for fertility in a male. And if you like this video, please comment, like and subscribe. Share this video with all your friends and loved ones. I'll be making many more videos, and I hope to see you soon. Vanakkam, namaste. This is Dr. Shah signing off for now.